Hello everybody, my name is Michael Shaw, and I'd like to, the reason that I'm coming aboard today and telling you everything about me was to let you know that you're not the only one that has had a very bad history with back problems. To start, what happened was approximately around about 3 years ago, I was working out with some very light weights, dumbbells to be more exact, and I was just doing some light squatting. For some unknown reason, I was doing good form, but I started to get the pain in the in my back. And at that point in time, I just put the weights down, and I started immediately having sharp shooting type of white pain type of sensations going up and down my back. Some time had gone by, maybe a year, maybe 2 years, and then it just started to get progressively worse again, to the point like when I was walking down the street, I would have to stop because in my left or right calf, I would start to get pain, and I would have to start rubbing it to be able to continue walking. And then one particular morning, which is the present time, about 3 months ago, I woke up and I could not stand any longer. And it made me very frightened. I didn't know exactly what was happening with me. I should say that when I first came in, I could barely walk. I was basically, to get to Dr. Morris's office, every 25, 50 feet, I had to stop and squat down in a kind of like I'm doing a sumo squat to be able to stretch my back out and relieve the pain. And Vicodin and OxyContin did not even help. I mean, they basically, with the Tylenol, it did help. All three of the drugs at times helped, and then it was down to OxyContin and Tylenol, and then finally at the state that I'm at right now, it was just Tylenol, and then gradually no more Tylenol, and now I'm presently not taking anything. The herniation of the disc, it was basically around L4, L5 area, and in addition, I had herniations around L2, L3 in addition to that. And also, I had the vertebral pulp in L4 was kind of like protruding out, kind of like, and I think I may have, if I recollect pretty well, is that part of the bone of L4 was more or less leaning up. They used the term impinging on your L5 nerve. I had seen 2 medical doctors in my family practice that I have to attend to, and both of them were basically very skeptical. And however, upon each subsequent visit to these particular family physicians, they noticed a tremendous difference in my behavior, in my stance, in the way I stood up and walked, and things of that nature. And they began to get a little more curious and ask me a little bit more, what was the doctor actually doing? Most of the doctors had never even heard of the DRX machine or the protocol that one is supposed to follow. But he, referring to Dr. Morris, started me off at a light weight on the machine that gently, with no pain whatsoever, started to go and improve my back and my ability to walk without pain. As the months, or I should say as the weeks progressed, gradually, the pain decreased in my right leg. I was able to go and walk more distances. I did not have to go and squat, and I also noticed that my regimen of medication decreased. Morris and his colleagues have done an extremely good job. I can only speak in the superlative as far as his bedside manner, and also his protocol in which he approached me and tried to go and treat me, and he's explaining everything along the way. If you are at all suffering anything remotely close to what I have experienced, you should come to see Dr. Morris, because he can truly help you to become a well patient and be able to go and gather your life back to the way it was previously.